Hi class, in this discussion we're going to focus on our cranial nerves. So let's dive into it. The cranial nerves themselves are nerves that exit directly from the cranium. Our body and brain need to communicate with the rest of the body, and these cranial nerves, instead of exiting from the spinal cord, are going to exit from the brain itself. And there are 12 pairs of cranial nerves. As these cranial nerves exit the cranial vault, they're going to exit through the foramina, or foramen singular, of the cranial vault. We talked about several of these foramen within the lab. And then these cranial nerves are going to go to muscles or sense organs within the body to allow for us to still have coordination and control of our body, even if we have a spinal cord injury. So as we're looking at these cranial nerves, most fibers of the cranial nerves begin within the brainstem and then are going to go to glands and muscles. We're going to have some sensory fibers. I should say most of the motor fibers begin within the brainstem. Sensory fibers are going to begin with receptors that are in the head and neck, and then go primarily to the brainstem. So as we're looking, or really to paraphrase this, the cranial nerves are going to carry sensory information, typically carry sensory information from the head and neck. And then the motor functions of the cranial nerves are typically going to go to glands and muscles. As we look at cranial nerves that are going to carry fibers between the brainstem and the rest of the body, these are going to be ipsilateral fibers. So if we have a lesion in our brainstem, this can cause a sensory motor deficit on the same side. If you don't remember, ipsilateral is the opposite of contralateral. Ipsilateral means same side. So the nerve fibers do not cross over from left to right. Whereas if they are contralateral, they cross over, they desiccate, and go over from left to right. There are some exceptions, though. The optic nerve has half of its fibers desiccate from the left to the right, and the trochlear nerve is going to have all of its efferent fibers, all of its motor fibers, lead to muscles of the opposite or contralateral eye. As we're looking at the cranial nerves, some of our cranial nerves can be sensory, some can be motor, and some can be mixed. Our sensory cranial nerves are cranial nerves 1, 2, and 8. And our motor cranial nerves are cranial and exclusively motor nerves are 3, 4, 6, 11, and 12. These motor nerves are going to stimulate muscles and also are going to contain some fibers of proprioception. And then finally, we have mixed cranial nerves, 5, 7, 9, and 10, that are going to help with sensory and motor functions. As we look at the facial nerve has a sensory role in both the taste functions and is going to have a motor role in facial expressions. As we look at this figure, if you see a red arrow going away from the brain, that represents a motor function of a cranial nerve. If you see a green arrow going towards the brain, that represents a sensory function. And some of these cranial nerves, like down here, cranial nerve number 9, the glossopharyngeal, has both a green and a red arrow moving on it, representing that it's a mixed nerve. It carries both sensory and motor information. So let's talk about these cranial nerves. Cranial nerve number, or as we number these cranial nerves, they're going to be numbered from rostral to caudal. So from anterior to posterior, generally speaking. Nerve number 1 is the olfactory nerve, and I want you to associate that one with smell. The olfactory nerve can be thought of as the olfactory bulb and the olfactory tract. Usually those are what we identify with the olfactory nerve as we're looking at it. And it's going to have fascicles, or sometimes referred to as rootlets, through the cribriform plate of the ethmoid bone down into the nasal cavity to pick up our sense of smell. We also are going to have optic nerves. Cranial nerves number 2 is the optic nerve. And the optic nerve is going to merge with the brain at the optic chiasm. And as the name implies, is used to carry visual signals. As we look at the oculomotor nerve, cranial nerve number 3, it's going to be a motor nerve. It's going to control the pupil, size of the pupil, so the contraction or dilation of the iris, and it also is going to control movement of the eye. Muscles that are controlled by the oculomotor nerve include the superior rectus, the inferior rectus, the medial rectus, and the inferior oblique, the muscles associated with eye movement. Not all of them, but a lot of them. As we look at the trochlear nerve, this is another nerve that is going to be associated with movement of the eyes. In particular, this nerve is only going to control the superior oblique muscle of the eye. As we look at the trigeminal nerve, the trigeminal nerve is the largest of all of our cranial nerves. It is fairly extensive, as it has three big branches. The three large branches of the trigeminal nerve include the ophthalmic branch, the maxillary branch, and the mandibular branch, or division. And those different divisions are going to be the sensory nerves for three different regions of the face that are shown within this figure that I'm drawing the arrows on right now. So the ophthalmic vision is going to be associated with the forehead, eyes, and nose. The maxillary division is going to be associated with the upper jaw, and the mandibular division is going to be associated with the lower jaw, or the mandible. As we look at the abducens nerve, cranial nerve number 6. This is another nerve that is going to be a motor nerve. It's associated with moving the eyeball. In particular, it's going to be the nerve associated with the lateral rectus muscle of our eyeballs. So it's going to allow for us to turn our eyes to the left or right. It's going to allow us to turn an eyeball laterally so that we can look to the side. As we look at the facial nerve is a fairly large nerve of the face. It's a major motor nerve that has some large branches. The facial nerve is going to control many of our facial muscles, expressions, salivary glands, tear glands, the palatine glands, so salivary excretions. The facial nerve is also a nerve of sensation. It allows for us to have our sense of taste on the anterior 2/3 of the tongue. So in addition to controlling the salivary glands and muscles of the face, the facial nerve is also going to control the sensory information from the front 2/3 of our tongue. And I really wish this would get out of the way. Apparently, there's a glitch in the software. I can't move this above the top half of the screen. We'll just nest it over here in the corner. All right, here we go. So in terms of damage to this nerve, if somebody has damage to the facial nerve, they can have sagging facial muscles because they aren't going to be able to send innervation or send action potentials to that muscle. There's also a disturbed sense of taste because particularly sweet and salty are affected. We don't have sensation from the anterior 2/3 of our tongue. We've lost most of our sense of taste. So clinically speaking, to test for damage to this nerve, they can test the tongue with sugar and salt, vinegar, and you're familiar with all of those. Quinine is one that most of you probably are not familiar with. Quinine is a standard bitter tasting chemical compound. And they can also test response to tears by taking the eyes and just exposing your eyes to ammonia fumes and or onion fumes, and just to see if you'll tear up. And then they can also test your motor functions by asking you to do things like close your eyes, smile, whistle, frown, etc., etc. As we look at cranial nerve number 8, that is the vestibulocochlear nerve. It is going to be connected to the vestibule of the, let me switch colors here. The vestibule of the inner ear, let's go with red. The vestibule of the inner ear, there, you can see that easily, and the cochlea of the middle ear. And it's going to conduct equilibrium information from the vestibule. It's going to have sound information being conducted from the cochlea, and because it can't move, and combined, we call it the vestibulocochlear nerve. As we look at the glossopharyngeal nerve, let's just look at this name. Glosso can refer to tongue. Pharyngeal refers to pharynx, or the back of your throat. The glossopharyngeal nerve allows for us to control our tongue and coordinate our swallowing. It also is going to help control the parotid gland, the largest salivary gland. So it's going to be the nerve primarily used to help us swallow food or swallow materials. As we look at the vagus nerve, this is the wandering nerve. The root word behind vagus nerve is the same root word behind vagabond, or somebody who just wanders around without a home. So as we look at this vagus nerve, the vagus nerve is a principal nerve of the parasympathetic nervous system, and it's going to go to many different organs of the body. As this vagus nerve travels throughout the body, it's going to help to slow down the stress response or modulate the stress response. It's also going to help to regulate swallowing, speech. When we say viscera, this means organs of the abdominal pelvic cavity. If somebody has damage to that cranial nerve, they may have hoarseness, they might lose their voice, they may have difficulty swallowing, and if both vagus nerves are cut, look at all these organs that they are no longer able to properly control. It's oftentimes fatal if both of the vagus nerves are cut. As we look at cranial nerve number 1 moment here. I think I skipped a slide. Nope, never mind. I'm just going crazy. Oh, so many lecture recordings. All right, so as we look at the accessory nerve, cranial nerve number 11, our accessory nerve is going to be associated with moving the sternocleidomastoid, my favorite skeletal muscle, and the trapezius. So the accessory nerve allows for us to move our head and neck around, to hold our head up and to pull our head down, depending on which of the muscles we're using. As we look at cranial nerve number 12, the hypoglossal nerve. Hypo means below. This nerve is going to go to from the bottom of the tongue. Glossal refers to tongue. So it's the below tongue nerve, the hypoglossal nerve. It allows for us to move the tongue. And that is cranial nerve number 12. That's all we have for this recording on cranial nerves. If you have any questions or comments, please feel free to post them on the class discussion board or shoot me an email. And as always, happy studies.